start again. Good morning, ladies and gentlemen, stakeholders and members of the media. Welcome to this media briefing of the South African Pharmacy Council on the outcome of the SCA judgment regarding pharmacist-initiated management of antiretroviral therapy. We will start in a matter of 2 minutes, so please bear with us. Thank you. Good morning once more, ladies and gentlemen, and welcome again to this media briefing. My name is Madimeja Mashishi with the South African Pharmacy Council. I will introduce the panel of today. Following that, we will go through the program of action for the briefing, and we will get into the briefing afterwards. So the panel is made up of the President of the South African Pharmacy Council, Mr. Moholoholo Pasha, Council Member and Professor of Pharmacology and the Chairperson of the Education Committee, Professor Natalie Shellack. We also have Council Member and Chairperson of the Practice Committee of the South African Pharmacy Council, Dr. Sham Moodley. We also have the Registrar and CEO of the South African Pharmacy Council, Mr. Vincent Tlala. We also have the Chief Operating Officer of the South African Pharmacy Council, Ms. Mojo Mokoena. Ladies and gentlemen, the program of today will start with the President of the Pharmacy Council giving the media statement on the outcome of the court case. And we will then take questions from members of the media. If time allows, we will take questions posted in the chat by stakeholders. Ladies and gentlemen, welcome once more. I would invite the Pharmacy Council President and Ade Moholoholo Pasha to give the media statement. Ade Pasha, the floor is yours. Thank you.
Thank you very much, Dade Mashishi. And let me also take the opportunity to welcome everyone who has joined us for this very important media brief that we are having this morning as the South African Pharmacy Council. I thank you for your time and giving us your time to be part of this brief. Without wasting more time, I will go straight into the media statement and I will read it through. And then, as Dade Mashishi indicated, we will follow that with questions thereafter, if the panelists or members who are here have any questions to us. This is the media statement on the expanded access to HIV and AIDS treatment, now a reality after the Supreme Court of Appeal dismisses appeal. After the Supreme Court of Appeal dismisses appeals seeking to stop PIMART. The regulator of the pharmacy profession in the country, the South African Pharmacy Council, welcomes the decision of the Supreme Court of Appeal in relation to the legality, rationality, and necessity of pharmacist-initiated management of antiretroviral therapy, also known as PIMART. The Supreme Court on Thursday, the 9th of October, dismissed an appeal by the IPA Foundation, which sought to set aside a 2023 ruling by the North Gauteng High Court dismissing their application to prevent the implementation of PIMART. The ruling confirms what has been our long-held view that PIMART is a necessary and competently designed intervention program to support South Africa's fight against HIV and AIDS. South Africa has the largest number of people living with HIV worldwide, and the largest HIV treatment program globally. PIMART, a service only to be provided by pharmacists with specialized training, increases access to much needed HIV prevention and treatment care, with the immediate benefit of improved quality of life and increased life expectancy for more persons living with HIV and AIDS. It will also improve efficiencies in the healthcare system in that HIV positive patients whose statuses would have gone undetected until they need hospitalization due to complications and being immunocompromised would now know their statuses earlier and suppress their viral loads through treatment provided by the multidisciplinary healthcare team, which now includes pharmacists. PIMART remains an appropriate intervention to support the existing treatment and prevention mechanisms of HIV and AIDS. PIMART will help reach a large number of underserved, undertested, and hard to reach populations who are currently without access to HIV prevention and treatment services. The nation's plan to ensure that 95% of persons living with HIV and AIDS, also known as PLWA, are aware of their statuses. 95% of them are on treatment, and 95% of those on treatment are virally suppressed, is more in reach and implementation of PIMART. PIMART-trained pharmacists will provide HIV medication, including post-exposure prophylaxis, known as PEP, PEP, pre-exposure prophylaxis, known as PrEP, PrEP, and first-line antiretrovirals. This initiative bridges critical gaps in care and support the country's National Strategic Plan, NSP, 2023 to 2028 for HIV, tuberculosis, and sexually transmitted infections. The South African Pharmacy Council, together with stakeholders and the Department of Health, will work with speed to ensure that PIMART-trained pharmacists join other healthcare professionals in providing primary care in relation to HIV and AIDS. This includes the provision of first-line antiretroviral treatment, as well as HIV testing and prevention services. While we are beyond disappointed that over the period that PIMART has been litigated against, the country's potential to treat untested, untreated, and hard-to-reach populations has been sorely restrained. We have confidence that the implementation of PIMART would bring access to those South Africans who were, for various reasons, unable to access life-saving treatment and HIV prevention services. While great strides have been made, with more than 5.9 million people being on antiretroviral therapy, the nation has not yet reached all persons needing HIV treatment. As at the last Department of Health annual report, at least 1.1 million people who knew their statuses were untreated. Over the past 5 years since PIMART was proposed, about 1 million people have been newly infected with HIV, according to the Tembisa model version 4.8 estimates. Furthermore, the mid-year population estimates released by Statistics South Africa indicates that between 2021, when PIMART was first litigated against, and this year, 2025, at least 395,000 HIV-related deaths are estimated to have occurred. We believe that the collaboration of pharmacists in the fight against HIV and AIDS through PIMART would have helped reduce the negative impact of the disease in our nation over the last 5 years. The PIMART program is designed such that it fosters collaboration with other healthcare professionals, including nurses and doctors, in the provision of HIV care that is aimed at increasing accessibility to prevention and treatment in line with the national treatment guidelines to ensure increased life expectancy and quality of life for persons living with HIV and AIDS, while arresting the increasing HIV infection rate. PIMART's implementation further accelerate the attainment of the commitment made by President Cyril Ramaphosa during the 2025 State of the Nation address to reach 1.1 million untreated persons living with HIV and AIDS by the end of this very financial year. Ladies and gentlemen, that will be the end of the media statement that we are issuing as the Southern Pharmacy Council this morning following the 9 of October SCA court ruling. I will hand back to Ndade Mashishi.
Thank you, Ndare President. Just to give an announcement to members of the media, the statement will be in your inbox in a matter of the next 5 to 10 minutes. We will open the floor for questions, and the coordination of the questions will be handled by Ndade Glenn Vuma, the Manager for Communication and Media at the South African Pharmacy Council. The floor is open for questions from members of the media first. You will raise your hand and the team will unmute your microphone. Then you can ask your question. Stakeholders are free to start popping their questions in the question and answer function. Thank you.
Good morning, colleagues, members of the media. Mr. President, the first question would be from Ms. Jana Marks from the Business Day.
Hi all. Thank you for sharing the statement. I'm just curious, what do you think the estimate need is for people not yet on treatment? Do you have perhaps latest figures for the treatment gap?
No, thanks, Jam. From our side, the figures we have is that there's 1.1 million untreated persons living with HIV/AIDS. So we think we should be able to play a role in reducing the numbers.
Thank you.
Okay, the second question would be from Inas Kosana. Ina, are you able to unmute yourself? Let's try again. I think while you try unmuting yourself, Ina, can we move to Refilwe Meko?
I might have missed it. I just wanted to find out, what does the ruling mean for the council? Thank you.
All right. So I think I also want to indicate that the panelists who are here also, Dr. Mutli and Professor Shellac, please feel free to take some of the questions as you see it fit, or even to add. Just to answer your question, Refile, I think for us as Pharmacy Council, this is a step in the right direction in that the patient becomes the winner. We are having more hands on deck. We are adding an extra layer of a professional called the pharmacist to join in the fight against HIV and AIDS. And this professional is joining other professionals, as indicated in a statement, such as nurses and doctors. For us, that is the most important part of the ruling. Thank you.
Thank you, President. The next question will be from Cliff Shiko.
Can you hear me?
Yes, we can.
Okay, thank you. I just have two questions. The first one is, do we know why this group of practitioners wanted to prevent the pharmacists to dispense these ARVs? And then the second question is, for those who don't know, does pharmacist provide this medication free of charge, or there is a fee that you have to pay compared to those who are preferring to go to a hospital or some private hospitals? Thank you.
Dr. Mutli, I think I saw your hand going up. Maybe you want to take that question.
So there's two parts to that question. I'll let the registrar answer the first one, and it's directly related to the reasons for this going to the two courts, and I think it's in the court documents itself. The second issue about the movement forward, maybe a little bit on that. So remember, there's already just over 1,000 healthcare professionals working within the pharmacy framework that have completed the training course. So the block had been in that they needed to be issued with the Section 22A15 permit that allows them to utilize those Schedule 4 drugs. So that needs then to go back to the DG to be signed off so that that process can continue in pharmacy. And that's where that is at. Then the second part of it is to expand that training program and include more trained pharmacists into the program and their staff so that we could then expand the services across the country. So that is in terms of the training itself. In terms of how the drugs will be managed, what the pharmacy profession is hoping is that with universal health coverage, the movement towards NHI, that this could be probably the first part of a module that we could generate, like we did with the COVID vaccines, where we utilize the state stock and administer it to the patients. And it will be a free service to the patient itself. But in terms of the service itself, just like how you would go to any other healthcare professional, this would probably be a paid service, or at least something that is subsidized by the government, and patients could have access to that treatment within the framework of pharmacy.
Thank you, Dr. Mutli. I see Prof. Sherlock also maybe likes to make an addition there, Prof.
Yes, no, thank you, Dr. Mutli, and thank you for that question. I also think what's important to recognize is in the question, if pharmacists can dispense, or, why was there this court clashing? I think what's important to realize about PIMART is that it's just an expanded scope of practice. So it's designed to train pharmacists with required supplementary training and registered with the Department of Health to start PrEP and PEP and first-line antiretrovirals, and then to also assist, with some of the preventative care, which is also in line with what we have with the National Strategic Plan, which is really a game changer in allowing more decentralized care of HIV. If you think about a country with the greatest antiretroviral program, I mean, it's a game changer. And then just to say, you are talking about, perhaps just dispensing. But I think one must remember that with the PIMART court ruling, there's expected direct outcomes. In other words, it means that having access to one of the country's most easily accessed healthcare providers means that there is an opportunity to have increased HIV diagnosis. You've got early antiretroviral treatment. That's the immediate effect. You already have improved access, which was the one part that we couldn't get of the 95. So we were always at 76. But also not just antiretrovirals. Think about PrEP. Think about reducing HIV transmission. Think about people that have been abused sexually, people where you've got, trauma and rape and so on. There's also increased opportunities for adherence because it's the pharmacist who's going to see this person. And then, some of the indirect effects is also that we've got greater uptake of self-testing kits. We've got earlier opportunities for HIV and STIs. And then if you think about the country in general, the congestion that we have at primary healthcare clinics and thinking about the national health insurance, this opportunity and this court ruling allows reduced healthcare facility congestion. So some of those are indirect effects with some decentralized pharmacist-led services. And then also there is, as part of the training, there's digital health. So it also assists with digital healthcare services and then some gaps in healthcare infrastructure. So really, as our president have said, it's a win for the country. But as the court ruling has so clearly stated, it's a collaborative approach. But in this collaboration, it helps us to assist the vulnerable population. So thank you, Mr. President.
Thank you very much, Prof.
Chair, if I could maybe deal with the question raised around why the group of doctors took South African Pharmacy Council to court. Among the issues raised by the doctors is that they believe that the new scope of published by a pharmacy council encroach on the domain of medical practitioners, in the sense that they believe that pharmacists should not be allowed to prescribe such medicines. And their contention was around procedural and substantive fairness. But in both the court ruling, I think the court has come out clearly that the South African Pharmacy Council has followed due process in terms of the publication of the board notice and invited the necessary stakeholders to put comments. And we're not doing anything new from what we have always done. So the court has ruled, I think, in our favor on both cases at the high level and at the Supreme Court of Appeal. So from our perspective, we believe this allows all of us to move forward, to work closely with all the practitioners, including doctors, to attend to our patients. The disease requires all of us to be working collaboratively. Thank you, Chair.
Thank you, Registrar. Bedebuma.
Thanks, Mr. President. The next question would be from Mutebang. Mutebang, are you able to unmute yourself? Okay, I think while we try get Mutebang's mic sorted out, next question would be from the chat. I'll just go through some of them that the President. I just saw one from Banele that I need to ask you. Banele from Business Report, what are the commercial considerations in the opposition? Do pharmacists expect subsidies on the treatments?
Vuma, please say it again, the question again.
Not a problem. The first part of the question is, what are the commercial considerations in the opposition? And then the following on would be, do pharmacists expect subsidies on the treatments?
All right. I think I'm not sure if I'm really understanding the first part of it. But the second part of whether the pharmacists expect subsidies, I think it is clear that I think Ndade Mutli talked or touched on this point earlier on when he mentioned that the treatment of HIV and AIDS in the country follows a specific program, which is drawn by a Department of Health. So in terms of Department of Health program, where possible, people will get medication according to the protocols at the public hospitals and public clinics. But in terms of if people want to access care through private means or private pharmacies, as per usual, the people will be expected to pay a fee if they are accessing private facilities. But with that being said, we cannot put away the fact that there could be more collaboration and more decisions taken with the Department of Health in terms of how access can be expanded through some subsidies to patients. As Ndade indicated earlier on, just like how we dealt with the COVID vaccine program, and also not only that, we are also having pharmacies who are providing the immunizations to the public, which are also subsidized by the state. So if the department would like to also expand the service, there could be also those kind of talks that will follow. These are early days. There will be more discussions and more ways that will be found in terms of how to expand care. So I think we will subsidies, it is possible, but it is still to be engaged with the department on how to expand care. I'm not sure if anybody understood the first part and if he's able to take it. The part about the commercial considerations on the opposition. Prof. Shelan, I see your hand up.
Yes, the commercial authorization, not necessarily, but what I wanted to also just add is that there is lots of collaborations already happening. So for example, if you look at family planning and EPI, which is a private-public partnership, where there's stock for free and the pharmacist charge a consultation fee to see the pharmacist. But I think, as you've said, Mr. President, lots of discussions with the Department of Health to access public ARV stocks. Thank you.
Thank you, Prof.
No, Chair, maybe I could deal with the issue of commercialization. From our perspective, it's not something that we've been worried about. While we know that from the doctor's side, they saw it as a threat. And our message to the doctors has always been that we see there's an opportunity for collaboration, that patients that could not ordinarily have been seen the practitioner would be screened, seen by the pharmacist, and obviously those that require the attention of a doctor would be referred to a doctor. So our perspective has always been seen as a collaboration effort, not any way encroaching on scope of practice or competing with doctors, but we see this as mutual workspace.
Thank you, President. I think the next question then would be on the chat as well. I'm not sure if Mutebang has sorted out the connectivity issues. but I'll move on to the next one. It's from Sitola. Is there a list of approved institutions accredited by SAPC for the provision of PIMART course?
Ma'am Gwena, please take it on.
Thank you so much, and good afternoon, good morning. I'll take the two questions on the chart. In terms of the list of institutions accredited by Pharmacy Council. Prior to the court case, we had interested parties that wanted to be accredited with Pharmacy Council to deliver the training. Following this briefing, we would be following our accreditation process to look at that interest. And the following question, which talks about how does this affect those who have already been trained out there, we will release a formal communication to the profession to outline the process to be followed to ensure that those who are interested, because part of the move from the office is to increase the number of pharmacies that are trained, that have the permits, that can offer this service so that we can assist the Minister and the Department of Health to reach that strategy. So we'll release that communication, which will outline step by step what will follow. Thank you.
Thank you very much, Ma'am Gwena. That everyone?
Thanks, Mr. President. The next few questions that I'll read out are from Marcus. The first one would be, what are the next steps in going from the court judgment to qualifying pharmacists actually prescribing and dispensing ARVs in pharmacies? Can prescribing and dispensing start happening right away, or are there some further technical hurdles that have to be crossed first? Then I'll move to the second one. Can you explain to members of the public how it will work now from this perspective? Example, would someone who wishes to access PrEP now simply be able to go to a pharmacy and ask for PrEP? I can repeat them if it will allow.
No,
What
I
are the
don't think
next
there's a
steps
need.
in going from the court judgment to qualifying pharmacists actually prescribing or dispensing ARVs in pharmacies?
Okay, I'll take the first one, and I hope that the colleagues can take the second one. On the registrar can also take both, but I think the first part is that in terms of the next steps, as indicated earlier on, there's quite a number of pharmacists who have already underwent the training, and those who have underwent training, obviously they did not have the permits, the Section 22A15 permits, which allows them to then prescribe this medication. But they will have to go through that process first. So the first process is to go through the process applying to the DG of Health, the Director General of Health, to get the permit. And then from the permit, then is only then that members of the profession who have underwent the training can start dispensing the medication. I think it's very important to also emphasize that only members of the profession who have done the course will be the ones that will be able to give the medication, to prescribe the medication and of course dispense it. But it's not like every pharmacy can just from tomorrow start giving medication or prescribing PrEP and PEP and similar. No, there is some process that needs to happen that follows the ruling. Ndadetala, I'm not sure if you would like to expand on that or any of the panelists.
No, thanks, Chair. I think from our side, the system has always been ready for us to get pharmacists to apply. It's a matter of doing final testing. Once we are ready, we would issue an e-note to all pharmacists who have completed the training, asking them to apply using our electronic system to apply for the permits. We will be working closely with the Office of the DG to ensure that once the applications come through, they are being processed swiftly. We would also, again, once more, write to the DG informing the DG of the court case outcome, because from our understanding with the Department of Health, they had indicated as soon as the court has made the ruling, they are happy to continue with the issuing of the permits. So we expect that that would happen.
Great.
Thanks to the President. The next question is from Michelle Gumede. Can you share the timelines of when the PIMART will be rolled out? How many pharmacists will be trained when the program is at its peak?
Dr. Mutli or Ma'am Gwena?
I think currently we have on record around 488 pharmacies that are active, and they are active together with the Clinician Society, the HIV Clinicians, South African HIV Clinician Society, where there's a collaboration and patients are seen in a pharmacy, but together with the Clinician Society via an online system using one of the mobile apps. So that's active at the moment. And as soon as these permits are issued, then that consultation process might actually be reduced, especially in terms of PrEP, for example. If you look at certain countries, 98% of PrEP in certain countries are issued through community pharmacy. So that could become the norm in South Africa once these programs are active and pharmacists qualify in the protocol. Remember, the qualification process has to go through these pharmacists going through 160 notional hours of training together with doing 18 modules. And these were designed by the South African Clinician Society. The HIV Clinician Society, they're the real experts in the country, have put the program together and trained those pharmacists already. So we're going to use the same kind of modeling work and continue the program going forward. So that would be probably the process from step 1 to step 2, where there's more pharmacists will qualify utilizing that baseline material that we've already designed, and the Clinician Society would probably update the 18 modules to include anything new that might come through the Department of Health in terms of protocol or interventions that the Department of Health are using at the moment. Thanks.
Thank you, Chair. The next question is from Cliff again. If the ruling had went against the SAPC, how much impact will that have been on the provision of these services?
Maybe let's answer by saying that we've always held the view that the ruling would never go against us. For that matter, we were prepared to go all the way to Constitutional Court. And I see there's a caution which says, are doctors allowed to go to Constitutional Court? I think all citizens are allowed. They would have to petition the court and put their case why they want to do so. But South African Pharmacy Council will again defend its action at the court of law. What is clear from the ruling is that we go ahead with the implementation. Even if they go to the Constitutional Court, the ruling is saying to us, the work must go ahead and we will be implementing PIMART. We hope from our perspective that this bring an end to litigation, and it again, we call on all our colleagues, the medical doctors, to work closely with pharmacists, and we will continue to work with all other statutory councils, because what we require is not to spend time at courts, but to ensure that there is patient care. And I think our colleagues say the same. So this closes the matter with regard to the legitimacy of pharmacists prescribing ARV. And we hope it brings an end, and the patient ultimately is the winner. As the president has said, they would have access to quite an avenue. They can go to the doctor, to the pharmacy, to the clinic. So there's multiple places where the patient should be able to reach their treatment.
see Dr. Mutli's hand is up. Dr. Mutli, you'd like to add?
Yeah, Chair, just in terms of possible impact going forward. Remember, during this litigation period, there were around 390,000 deaths in the country from the issue of HIV and AIDS. And if you look at the data just being released by the Department of Health, about 111,000 people have dropped off the program. So that's work to be done, not just by pharmacists, doctors, and nurses. If you think about the psychosocial implication around the 111,000 people that have dropped off, we need the psychologists, social workers, and others to join this program so that they could become part of the narrative in trying to find these patients and ensure that the next generation are HIV-free. And that's the target for all of us. And we're encouraging everyone in the system, all healthcare professionals, anyone working within the framework of HIV and AIDS to sit down with us and have this narrative so that we could assist the National Department of Health in solving this major problem that we have in the country. Thank you.
Thank you, Ndare Mutli. Ndare Vuma?
Thanks, President. The following questions would be from the stakeholders, so I'll read all of them, but individually so. First one is from Bronwyn Melanie. Would it be possible to have the permit process streamlined similar to the COVID permits? And then obviously a statement following on, this would allow a fast turnaround time. Additionally, while exploring the state stock solution as mentioned earlier, can this also be listed as a service for which a fee can be levied as we do with other services?
Ndare Tlala, would you like to take the first one?
No, thanks, Chair. Maybe let me deal with the last issue raised. We will be updating the board notice with regard to the services for which pharmacists may levy a fee sometime in November, Chair, and we would also include PIMART as one of those services that a pharmacist would be required to be paid for. In relation to the system, yes, as I said, Chair, already the system has already been put in place. It's a matter of doing the switching on and testing, and the system was designed such that the applications would be seen by the Department of Health on the other side. So we're comfortable that fairly soon, once we have had engagement with the DG's office, we should issue an e-note sometime in November inviting pharmacists to apply, and permits will be processed as such. Thank you, Chair.
Right, I see Prof. Stelak maybe likes to add. Prof?
Yes. No, thank you, Mr. President. Just to answer the question in terms of, if it could be fast-tracked like COVID. I think the curriculum has been developed by the South African Clinician Society, but I have to add it's also been developed by the South African Pharmacy Council. So in other words, the Education Committee from the Pharmacy Council and the Pharmacy Council worked with the Clinician Society to work within the current regulatory framework. So that has already been established, and as the COO has also mentioned, there's a list of people who really wants to offer the course. But I think what's also important is from the South African Pharmacy Council side, there's also capacity building. So in other words, the capacity building and the training is also important to ensure that the pharmacist that's already gone through the course, we now will be clinically competent. So I think we are very positive, that we've got the systems in place. We know that our pharmacists have got the right capacity building and training and can really add great value in both a direct and an indirect way in picking up some of the people lost, as Dr. Moodley has said, but also providing other services now that we can track, including supply chain management and other beneficial primary healthcare services. Thank you.
Thank you, Prof. Ndare Vuma?
Thanks, President. The next question is from Ms. Jackie Myman. The pharmacists who have already successfully completed the PIMART training offered by SAPC, and have been supported by telemedicine to enable services, when will they be able to register their training and apply for permits?
Narendra?
No, Chair, we confirm that we would issue the e-note advising all pharmacists who've gone through training what is the process to follow. But we anticipate sometime in November, people should start applying.
Thank you very much.
President, the next question is from Ms. Eda Verster. Is there any engagement with the medical aids to cover the medication and consultation fee prescribed by pharmacists with the PIMART qualification and permit?
If we could respond directly, it's when we introduce the new fee, we consult with the Board of Healthcare Funders, who represents various medical aids. So we take it the same would happen. We would be consulting with them to also make sure that pharmacists are paid, specifically for those private patients who are not state-owned patients. Insofar as it relates to the state-owned patient, we expect that the pharmacist will work closely with the Provincial Department of Health to access the stock. I think that we expect as when we started this program, Chair, we were asked by the Minister of Health to ensure that there is an increase in access. So we anticipate that the same arrangements as pharmacists have around family planning and immunization would apply for ARVs.
Thank you, Narita. Narendra?
Thanks, President. The next question is from Ahmed Bayat. Does the EPAF have the option to appeal this ruling at the Constitutional Court? If so, and EPAF does appeal the decision, where does this leave the program?
If so, just that last part.
If so, where does this leave the program?
Oh, okay. Ndade, Ahmed, I think Ndade earlier on did indicate the fact that yes, they do have an option to go to the Constitutional Court. Obviously, they will seek leave to appeal the SCA ruling, and when if they are given the leave to appeal, then they will then appeal to the Constitutional Court. And if they are not given the leave to appeal, they will petition the Constitutional Court and give reasons why they should be given a hearing to appeal the court judgment. But in terms of what happens in the meantime, the letter indicated that for us, we are implementing the court ruling as of tomorrow. We have started. We are not stopping, and until further notice, pharmacists will be informed in terms of what are the next steps, as the registrar has indicated earlier on, that e-notice will be sent and everybody will be the profession will be informed of the next steps. And from there, we are going to be implementing the court judgment as it is. Remotely.
Chair, while that is true that there is a possibility of it going to the Constitutional Court, but I think the prayer and the hope of everyone, especially on this panel, Pharmacy Council, and a lot of healthcare workers out there, is that we as healthcare professionals can come together rather than going through court processes and work out how we can work together to best implement what we have and utilize the skills of everyone to mitigate some of the huge risks that we have, not just in HIV and AIDS, but in the multiple comorbidities that we have. And I think if you look at the process itself of where testing, self-testing is being done in pharmacies at the moment, we're finding patients that might be positive, that might require treatment. A lot of those patients might not be able to be treated by pharmacists. If they're under 15, if their viral load is high, if they've got comorbidities, they need to be refed. So that process, we think pharmacy will have a portion of treating in terms of first line, PrEP and PEP, but my own personal opinion is that a lot of patients, because of the comorbidity issue in South Africa, including TB, etc., will have to be referred, and we're looking for that referral pathway. So we're asking for this combination to be done very quickly so that we can move on this project and make it viable for the country. Thank you, Chair.
Thanks, Dr.
Thank you.
Muli. Thanks, Dr. President. The following question is from Mulangobeni. Would a PIMART certified pharmacist in possession of a permit from the NDOH and SAPC be able to operate and practice in any other pharmacy, or you would also have to provide permits for the facility?
The registrar?
No, Chair, we confirm that when permits are issued, there would be two processes. The pharmacists would have to apply that they want to be stationed at a particular pharmacy or they want to do locum. But what is clear in both instances is that all patients should be seen from a consultation room. So any pharmacy that has a consultation room should be able to offer PIMART.
Thank you.
Thanks, Dr. President. The next question is from Mutebang, who managed to get into our chats. I'm a practicing pharmacist working as a project manager within HIV research studies, and I've often observed a disregard for the involvement of pharmacists. My PIs and clinicians tend to overlook the critical value pharmacists bring to the investigational product value chain in clinical research. That's why I'm so proud of this recent judgment. I believe this is a statement more than a question. Kudos to the SAPC for standing firm and winning this case on behalf of pharmacists. This victory will help reverberate and reaffirm the vital position of pharmacists within HIV-related research and beyond. Then the question comes after that acknowledgement or rather comment. How might this judgment empower research pharmacists to be more visible and acknowledged in prescribing and treatment care of study participants within HIV research settings?
Thank you, Ndade Vuma. Prof. Shalak? Research.
I'm laughing.
Is yours.
So I think it's just important to go back to what the law was, what the court ruling was. So I didn't specifically focus, just on research pharmacists, but what the court ruling actually just said is that South African Pharmacy Council followed all procedural fairness. So in other words, there was public interest in terms of the urgent public health interest. There was legal authority because it was already a permit and an act in terms of Section 22A. That there was no encroachment in terms of the medical practice. So what Tabang is now also referring to. And also there were substantive arguments about patient safety training and legislative conflict. So that question in terms of research and patient safety, I think it also brought about that the training processes were fair and that it was for a public health imperative. So I think this just tells us, that it doesn't really matter where you are operating, but whether or not you are operating in a research facility and where you comply to the ruling in terms of having your permit and the training, and where you have direct patient service and interface. In other words, where you need to provide this access and care, a pharmacist can practice as long as you follow the guidelines are set aside. So yes, in a research facility, this is more about service delivery and then research in HIV, but it highlights the importance of HIV research. Thank you, Mr. President.
Thanks, Prof. Thanks, Dr. President. The last two questions, one is from the media, Inas Kosana. My apologies, I think the COO would like to add to that.
Thank you so much. With regard to the research that we're looking forward to. I want to take this opportunity to also announce that we'll be having our conference next year. There's a section there where we're going to look at ground-breaking research. And this is one of the topics that we're looking forward to look at some of the great work that is done out there, because we really need this work to be published and we need the public to know about these services, that those that might miss this victory that we have, that moving into the future, they know about the work that has been done out there and they are able to access these services. Thank you.
Thanks, Memukwena. Going back to Ina's question, which I believe was covered, how soon can we expect PIMART to be implemented? And then the final one from the chat, it's again from Ahmed. The SAHC permit has expired. Is there an opportunity for the permit to be extended to ensure ongoing training as a priority? And those will be the questions from the chat.
And Director or Memkwena?
Maybe if Dade Vuma can repeat the question around the expiry.
Okay, I'll go back to it, Dr. Tlala. The SAHCS permit has expired. Is there an opportunity for permit to be extended to ensure ongoing training as a priority?
No, regarding the issue with regard to the accreditation, as the CEO has raised it, we will be engaging with all the role players who previously showed interest, and we expect that they would now put their applications through and the accreditation should come to fruition. Obviously, they must meet the requirements of South African Pharmacy Council. So we expect that even those who were training will come to the fore. I think also on the issue of research, one must emphasize that pharmacists has always been in the forefront when it comes to research, not only relating to HIV medicines, but all new medicines that have been introduced. We expect pharmacists to participate in clinical research and to work closely with the clinicians around that. So this should not be new. I think it's an emphasis that of the role of a pharmacist around HIV and their importance.
Thank you, Dr. Registrar. Prof. Shelak, would you like to add?
Yes, maybe just also to talk about the timelines and prioritization and research. It's just, I think, after the court ruling has been received, it's important to understand that there are going to be various processes that may need to be put in place, some short term. So, for example, looking at all of those stakeholders, as the registrar has mentioned, looking at our current curriculum with and mentorship and support, and then the research in terms of how this really makes a difference, you know, and the equity it provides and the access and the 95, 95, 95, those will all, I think, be important long-term processes to monitor and manage. And then regarding the permits, I think the larger conversation would not just be the permits, but also CPD integration, because we also know that HIV is a fast evolving field. So it would be updated continuously as part of the processes that the SAPC follows. Thank you so much, Mr. President.
Thank you very much, Prof. Shelak. I think the day Madimeja indicated that the time was built to be 11 to 12. I see we are already after 12. The day Vuma, I'm not sure if you have pressing questions that needs to be taken, or we should be drawing to a close.
No further questions, Dr. President.
Are we sending it back to Ndade Mashishi?
Yes, thank you, Dr. President. And we've come to the close of the press briefing. All those questions that are still unanswered, we will put together and send in an email to stakeholders. Any other questions from stakeholders and the media? The media can send an email to commedia@sapc.za.org. Stakeholders can send to customercare@sapc.za.org. We thank you very much for your attendance, and we look forward to further engagements. Thank you very much. I've come to the close.
Thank you very much. And Ndadima Shishu, and indeed, let me
Thank you, Collins.
once again thank everybody for their time for this morning. Thank you. Goodbye.